everybody. I just wanted to introduce my wonderful, beautiful colleague and friend, Dr. Brian Waters. Normally at the Ginkgo Tree, Blake is our headache specialist, but today we have a different specialist, and I'm going to let him introduce himself a little bit. Dr. Brian Waters.
Thanks for having me, Jenny. Dr. Brian Waters, Indy Muscle and Joint Clinic over in Geist, rehab chiropractor. I went through chiropractic school in St. Louis and then did a master's in sports science and rehabilitation. So it gives me a little bit more background to talk about the rehab side of things, especially in our athletic populations. Thanks for having me.
So tell me a little bit about your specific things that you do and all of your chiropractic team do as a whole.
Yep. So I'm basically a rehab chiropractor. When you go to chiropractic school, it's kind of like going to medical school. You come out and you're like, I'm an MD, so I'm a DC, but then what do you do? So when you introduce yourself to somebody, yeah, you're a chiropractor, but what else do you do? That's kind of my emphasis there. So we focus on a lot of rehab stuff. What that means is we do chiropractic, we do the rehab exercise. So like three-pronged approach is kind of how I go through this, but the chiropractic side, the soft tissue side, which obviously you're an expert on, and then the rehab side. So the rehab side kind of keeps everything else together and makes it stick. But yeah, our team, we've got 3 chiropractors, 2 massage therapists, and 2 personal trainers. Our massage therapists are more, it's kind of like that rehab focus, trigger point stuff, specific team approach there. Our personal trainers, same thing. It's more of a rehab approach. So we kind of keep it all together in-house like that. But yeah, kind of the rehab side of things. So again, when someone says, hey, you're a chiropractor, I'm like, yeah, but I do this. So adjust, soft tissue, and the rehab kind of approach.
So if someone were to come to you that had like a different ailment, are there specific things that you will lead them to when it comes to, I guess, let's just say a headache or something along those lines?
Yeah, so it depends on the case, right? So the first thing we're going to do is a history, a full evaluation, make sure, okay, check off the boxes, no red flags, things like that. Do we need imaging? If I suspect trauma, fracture, tumor, infection, something like that, we're going to push out for imaging. Basically, we're going to try to do everything we can from a bone perspective as a chiropractor, from a muscle standpoint as kind of a rehab chiropractor, and then from a rehab standpoint as a rehab chiropractor. So we're going to kind of see if we can do that. Do you mean if we refer out to someone else, or when to know to refer out? Or
no, just I guess let me say this. I'm going to focus a little bit more on the headache thing because I see a lot of that comes into my office. So let's start with like how many different headaches do you think come in? Like how many different types?
So specifically the ones I see are tension headaches.
Okay.
So a lot of muscular stuff, musculoskeletal, which you're going to see that quite a bit too. From that perspective, first off, if it's a migraine, obviously there's multiple different factors, hormonal, I usually say there's 4 things: muscle, bone, circulation, nerve. So I approach it from those 4 perspectives. Tension headaches typically going to be that muscle and then muscle, I think, controls everything. So muscle can control the bone, muscle can control pressure or irritation to nerve or vascular. So we see a lot of tension headaches. So from that approach, typically we'll treat somebody 4 to 6 visits. I still check segmental stuff. So if you think about what is a tension headache, typically what I see is the traps, so the muscles that help rotate and laterally bend the neck, the big ones that we carry our stress and we sometimes breathe with, those get tight and compress and cause pain that can wrap around the head, and there's all kinds of different symptom patterns and things like that. But typically I see those. Obviously the soft tissue component is one of the biggest components. I think 80% of it's probably soft tissue. But then if we get to the bottom of that, is there, one of the segments in the neck, like the vertebrae, isn't moving, so then the muscle spasms to kind of control that, or is it's moving too much, so it's trying to spasm to stabilize. So I'm going to look at that segment of it more than just pushing on the muscles. But typically, the muscles can control that joint segment. So we're going to look at it from that approach. Sometimes we'll throw dry needling into the mix. Sometimes we'll throw grafting or scraping into the mix. Sometimes some cupping if we needed it. But a lot of times you have to figure out if that whole area that those muscles around is too tight or it's too loose. And then from that approach, if it's too tight, loosen it. But why is it too tight? So then we talk about posture and things throughout the day. If it's too loose, strengthen it and figure out why it's too loose. Is there arthritis? Is there disc issues? Is there neurologic things like that? Yeah.
And then how would you do, like if you have someone that is coming in with a headache, how would you tell them, or what would you say to them that would kind of help them go along the lines of a preventative versus, action? So what type of things do you educate them on to make sure that they are doing the best thing for them prior to coming in?
So the main thing that we focus on there is proper diagnosis, figuring out why the headache is there. So if it's a tension headache caused by posture, for instance, I don't harp on posture. Yeah. I harp on like controlling the muscles so that if we are in a bad position, our muscles can kind of hold us in a better position. So for me, the weightlifting component, the strengthening component is the big component there that I really want to make sure they're doing. That's their job. I'll teach them and I'll help them along the way, but they have to do the hard work of getting the muscles to kind of stabilize those segments. Posture setting, but we sit all day. Sometimes we have to. We drive. We use the computer. Even when we stand, you can see people slouch. So just getting them aware of that, I think, is a big component. But then trying to strengthen to kind of make them more robust so that, if you slouch a little bit, it's not that big deal. When you hang on your meat, as I call it, you're hanging on your muscles on the backside. If they're stronger, they can kind of keep you in a better position than if they're weak. So the big component of I guess what we do, instead of just passive care, is, hey, you need to be doing this stuff on your own at home to reinforce what you do, and you're not going to have to see me as much if you're doing your work, your job. So when somebody gets better, I can say, look, I helped you, but you did the work. That makes sense?
Yes. Is there a diet component that helps with that as well?
So then that comes into, what is causing this issue? Is it just a weakness issue? Is there an inflammation issue? If it's more neurologic, things like that, there's a diet component, I think, to everything. Personally, I think, and actually you've probably experienced this too, but when you eat certain foods, you feel a different way. Maybe I eat that donut and then an hour later I feel like crap because that sugar just hits you and knocks you down, but it causes inflammation. That's not my expertise, but we talk about that in the office. I try to give everybody those perspectives. And then there are those professionals that we'll refer out to in those cases like, man, Brian, this is one of those things that I have trouble with. I eat way too much sugar. I drink way too much pop. And then I'll say, okay, let's try to reduce those things, replace it with protein, replace it with better snacks. But yeah, those things are going to cause the inflammation, especially in a neurologic. I see that a lot with like the neurologic case or tight muscle case. And then you can go down the nutrition rabbit hole with, supplements, vitamins, different things that are going to kind of reinforce all that. And again, with what I do, I focus on one area, mostly the rehab component, but we can push that out to different people, give them like highlights. And then that's why most of my team, we're all kind of in tune with that, but we also have people like you that also have components of that too. So you're getting a massage, but you're also kind of helping them along with the, hey, how's your diet? How are you drinking enough water? Are you doing all these things? And that's the holistic approach, really, I think, of what we both do, but chiropractic and all the different factors.
And is there a medicinal approach that can help people, or is it something that is more beneficial to go along a holistic route?
Again, it depends on the person. So I always say meet the person where they come in. So if someone is anti-medicine, because we're chiropractors, they see us as a holistic type person, they're going to bring in the fact that they're not going to take medication. They're not going to do these things. So you'll sense that. You'll see that on the intake form. You'll talk to them and realize, okay, they're not going to do ibuprofen or Aleve or Tylenol or whatever. Not to say that those are the answers, but I'll say, okay, well, let's talk about what you can do, turmeric or some of these different things. And every day there's changing things, but magnesium is a big one. Water, magnesium, decreasing sugar. But the magnesium we've seen just relax the muscles, especially at night. ZMA is a big supplement that they've used forever for muscle recovery, which is zinc, magnesium, and I believe vitamin C, which is the A, aspartic acid, I think. So anyway, so if a patient comes in though and says, I've been taking ibuprofen and Aleve and it's not helping, okay, well, let's look at it from a different perspective. What do those things do? Those are anti-inflammatories. Those are controlling inflammation, at least in a sense that we think if there's damage to a muscle or acute inflammation caused by an injury, maybe diet-wise, it's not gonna help if it's a diet issue. And then Tylenol really just tricks the brain into decreasing pain. But those are also options. If somebody comes in and they're like, I am miserable with this headache's not getting better. If I suspect like, hey, you need to talk to your doctor, can I recommend as a friend, hey, try some ibuprofen Aleve, or have you tried ibuprofen Aleve or Tylenol? Yeah, but again, I try to stay away from that because it's really not my wheelhouse. And those would be more for like a muscle injury type case when we see swelling, inflammation, redness, things like that. But again, I try to steer them more holistically, especially if they're coming in expecting that from me.
Right. Now, if someone comes in with a sinus headache, how does that differ than a tension headache?
Right. So obviously sinus, that's a big one right now in the fall. From that perspective, I still address the same areas because of the lymph. You think sinus, okay, what are the things that we can do? Well, we know that inflammation can impact sinus. So decrease sugar, drink more water, all those things. If you have a fan, make sure the fan's going in your house, change your air filter, do all these things that you can do. But in reality, if you're going outside, you're going to be bombarded with these histamine reactions. I think really coming up with a game plan, like, is that something we can do as far as adjust the neck and help with, circulation or lymph flow? I know you do a lot of lymph work, so I'd probably push that out to you and say, hey, this person's really stuffy. Can you work on some lymph stuff? Here's what their history is and go at it. But sometimes acupuncture, we have like a sinus protocol. I call it like a recipe. We do acupuncture in the clinic along with dry needling and electroacupuncture, but certain trigger points in the face, you can even do acupressure, which I'm sure you know a lot of, in the ear and the face and the foot and things like that, even hand. But there are points on the face that can kind of reduce sinus pressure. So really then it's just addressing symptom relief. How can we reduce these symptoms? Honestly, in the needling, we've seen a lot of almost immediate changes with that. But again, getting down to okay, what is you're allergic to trees that have either dust or pollen or whatever. Well, I can't necessarily fix that, but we can help. If you think about the holistic approach, make your body again robust enough health-wise to take that on. But sometimes you got to take an allergy pill.
Yeah, unfortunately.
Yeah.
So then tell me the difference then with somebody who has a blunt force that maybe has a concussion that comes into how would you then work with that?
So if they come in, so I guess there's two approaches. One is they come in, they tell me, hey, I had a concussion, got diagnosed, I'm on concussion protocol, whatever that is with their group. Or somebody comes in and said, hey, I hit my head. I see both. Typically, if they come in and they say, hey, I hit my head, I'm sending them out immediately. I've got sports med docs that I will immediately get on the phone with and say, hey, I'm sending this person over. Not that I'm, obviously it depends on if they were in the middle of the night and they fell and hit their head, it depends on age. I'll check their eyes, I'll do some of the things I know to do, but immediately I'm going to say, you need to go get checked out. First off, that's not my expertise. I know, like, as an athletic trainer, you probably had that experience in that sideline type stuff. I could have, I never did, but we'll push that out to make sure that it's diagnosed properly and things like that first. But then as far as what I can do after it's diagnosed and after they're cleared for there's no bleeding on the brain, we'll do a lot of the same things as tension headaches, honestly, because a lot of those cases come in with whiplash type scenario. So their neck their head has had an impact and their neck has spasmed to control. So we see a lot of residual soreness. Usually it's about after 2 days. And then it's on for weeks sometimes, but typically within about 2 to 3 weeks, we can resolve that with soft tissue, needling to the upper neck. In those cases, do I adjust? Not quick. I'm not quick to adjust. Some of those you can, as they heal, you can kind of feel the neck respond with the soft tissue first, and then we'll adjust the neck, just depending on the case.
So tell me about dry needling. What does it actually do?
So I always talk about dry needling from a Western medicine approach. If you want the Eastern medicine approach, I always tell people that's not, again, my expertise. We have an acupuncturist. I am an acupuncturist, but my perspective is more Western. So I'll give you the Western definition. Really, dry needling, I want 3 things to happen. One, I'm looking for the target tissue, maybe trigger points, things like that. I want the trigger point to release or the muscle to relax. I want inflammation to the area because I'm poking holes. I want blood flow, just like if you would do a trigger point massage or if you would do scraping. You're bringing in things to the area to heal the tissue. And then the third thing would be we want to cover up pain in the brain. So those are really the 3 approaches. So you've got the muscle relaxation, which if you put electric stim onto those dry needle points, it's going to relax those muscles. With the second approach, or with the other two things, obviously you're going to get some blood flow in, and the covering up the pain in the brain. They're all kind of related to each other. So all that at once, I think it tends to do a pretty good job with relaxing the muscle and causing that irritation to go away. The acupuncture side of it is just the balancing. It's based on different things. Like if my pain's here in acupuncture, they may put points in needles down to my calf or down to my foot, and they're trying to balance, meridians and chi and things like this, yin and yang or yin and yang. So it's a little bit different approach. It's a holistic approach for sure, but they don't care exactly where the pain is, but they'll relate that to the body. It's a whole nother system. So it's like I'll try for the rest of my life to understand that system, but we're Western medicine. So we've lived this. But it's cool to know both. And they overlap over and over and over again. And where they overlap mostly is seams between muscles where they slide, and nerves, which usually occur at seams. So if we've got like tendonitis or something like that, we've got a seam here between two muscles, and then we've literally got a radial nerve around there. So we can affect all those tissues. Acupuncture is more about the nervous system. Dry needling is more about the muscle, I think, or the problem area.
So then tell me a little bit about your ART, which is active release technique.
So that's our big soft tissue system that we use. I've used it since 2009. It gives us quick results. ART is you're finding a trigger point, you're shortening the muscle. So in this case, some wrist extensors or finger extensors. You put pressure on the point, and then you stretch the muscle underneath the point. So it's an active release technique, obviously. So we're doing 3 or 4 passes with pressure. The cool thing about that is ART actually patented these pain maps or trigger point maps. Now there's all kinds, and they all kind of overlap together, but their specific maps really make sense to me with my other knowledge of trigger points. So we'll find, again, seams are big ones, spots between seams and muscles. And as you're doing the treatment, you can actually palpate and assess, hey, there's no slide here, let's treat it. So as you're doing one pass, oh yeah, just like when you're doing soft tissue, as you treat it, you're finding, okay, this is moving just fine, now we can go into the other segment. So ART kind of brings that whole thing together in a complete system. And it's got a great network across the country, especially with chiropractors, so that if I needed to refer you to somebody on the East Coast or West Coast or wherever, I just type in, I've got a database and I can find somebody. And usually I know them because I've had classes with them. So we have to get credentialed every year. So it keeps the fake ART people, we call them farts, out. So that's a terrible joke. But so ART is really cool. It's myofascial release, but again, what you're getting is a whole system.
Okay, what are other treatment plans that, besides all of the things that you do, what are other things that you can suggest for people to help them with specific headache issues?
Right, so the big thing now has been hormones. Again, we have to get to the bottom of what is causing the headache, what is causing the migraine, what is causing the tension headache. If it's an inflammation thing, if it's a healing thing, if it's a recovery thing, I see a lot of active people. So if they're doing a ton of shrugs, a ton of overhead press, I'm going to say, okay, we need to tone that back a little bit because you breathe with your traps too. So really thinking about the whole person. But lately we've been doing a lot of like sending out for hormones. We have someone that does that comes in. And I think the importance of that is as we age, the hormone levels change and recovery changes. So really anything you can do, again, like I said, we're emphasizing maybe on the hormone component now, but maybe next year it'll be more different forms of recovery, more cryotherapy, more. So we're teaching, okay, ice bath. We're doing, how do we recover those muscles? Because if those muscles are the key, if we're a lifter that lifts 6 days a week or more or less, you're traumatizing those muscles, but then you're using them throughout the day. My treatment plan is going to revolve around decreasing the time it takes to recover those muscles so that we can keep using them. So I think, again, right now the hot thing is hormones, because that kind of gives us it makes your body more robust to kind of deal with the day-to-day challenges of recovery. But that's what we do, and that's what you do, is we help people recover in a smart way, but we're learning things every day that's gonna help us. So yeah, the hormones are a big thing. Obviously hot, cold, sauna's huge. And we're just gonna encourage people based on who they are. I'm not gonna overload them the first day with like 25 things. Usually I keep it to 2. So it's like, okay, what are 2 things? What are 2 exercises? Let's start there. Let's see you next week. Let's see you in 2 weeks. Let's see where that goes. But again, 4 to 6 treatments. I want to make sure that they have a great understanding of what they can do long-term And then they can come back in and let me know, oh, hey, in 3 months they pop in. Hey, it's flared up a little bit. Okay, how's your diet? How's your hormone level? Have you been checking that with your doctor? Have you had blood work lately? What are your inflammation things like? Your foods, your diet change? As your activity changed, as your job changed, as the stress in your job changed, what can you do to manage your stress? So those we're going to throw in all into that treatment plan or that approach. Again, not try to overload them all at once because there's so many things you can change.
Truly. So you just start with one thing and then tick off each one of those things. And then what would be that first thing? Would it be a hormone thing that you would suggest for them to do to start preventing?
We'll probably talk about that on the first visit, especially. I usually target that after 35. Like if you're older than 35 years old, which most of my clients are, including myself, it's something we need to think about, especially if you are a healthy lifter or a healthy person that's active, or your job is active like you and my job. We need to make sure that you're, the hormone replacement doc that I work with says optimal. So and that's the name of the game. Like just live life optimally. And if you can recover faster and it makes sense to do that, with some of the options that we provide. But yeah, it just depends on that first day. And that's after, years of practicing that. How do you target the certain areas? They're gonna, if I tell somebody that they need to drink 2 gallons of water, a gallon of water, and they drink 1 cup of water a day or 2 cups, they're out there, those people, they're afraid of water. Yeah. I'm not gonna recommend that. I'm gonna say, hey, that's something we can work towards, but I'm not gonna spend much time because it's gonna make them frustrated. So I'll skip on to something else. Some things, hormones, they can do pellets, they can do injections, they can do all these things, lotions. So it's, what do I think they can handle? But again, that's not my realm. I'll introduce that, but I'm not going to educate them on that because that's out of my scope, let's say. But I'm going to try to stay within my scope and approach it. But again, as you get to know the person, especially with what you do, you're going to kind of peel back some of the layers of the onion as you get through. So maybe the first day I only work on soft tissue. They don't like a neck adjustment because they're scared, or they've never had it done. They don't want needles in them. They don't like needles. So I'm going to do soft tissue and give them 2 exercises. Day 2, hey, how's that going? Hey, you're 50% improved. That's amazing. Let's stick with that. Let's add another exercise. Or let's do a little mobilization of the neck and see if they're more comfortable with it. And then day 3, man, I'm at 80%, but something's just not there. Okay, let's talk about diet because we haven't yet. How's your diet? Well, I could clean this up. Shoot for that. Eat more protein. What's that mean? Okay, eat more meat, eat more peas, whatever, if they're vegetarian or vegan and that's, again, it's kind of an algorithm of where they're at that moment. And then maybe by the 4th treatment, they're 90% and they're like, okay, have you had blood work lately? Let's get a panel. Let's send you to a doc that does, the whole thing, like a holistic doc. And we have those people on our teams. So you just, and that's in 4 treatments, maybe in 5 weeks, you've accomplished 90% of what they need. And then you start kind of pushing. But some it's day 1. Hey, I've tried all those things, doc. I've done all those things. I'm perfect. Or they're an athlete and they're just firing all cylinders. Have you done your blood work? No. Okay, let's go there. But I'm going to do a little bit that first day anyway. Well, let's do have you had ART? No. Have you had dry needling? Yeah, I've had dry needling. It didn't work. Okay, how about scraping? How about this, that? Do you have a good massage therapist? Go see Jenny. So anyway, yeah, it just depends, again, meeting the person where they're at and then getting to know them, peeling back those layers.
And then what about kids? Like when younger kids, younger athletes, kids of anything, what do you do then? How does that protocol change?
Yeah, so hormones we're not even talking about usually because maybe they don't even started. They're 13 years old, they haven't even hit puberty. From that perspective, huge nutrition thing, even though they're pretty resilient because their bodies are so just awesome. I mean, their nervous systems are like fully capable. Sleep, come on. We haven't even talked about sleep, but that's probably in the top 3 things I talk about with young athletes. I am a strength coach also, which gives me this other language to speak and communicate with athletes. And I think the sleep, using the phones late at night, the blue light and all that stuff, I mean, I know they don't like to hear it, but when they are really passionate at what they do, if I say, hey, this will give you 1% better chance at beating that other person, it'll give you a second faster time, maybe, do it. You might as well. You're drinking beet juice and doing upside down jumping jacks. So it's like, you might as well throw this in the mix. But communicate to the kid, depending on how old they are. If they're 8 years old and they're a gymnast, maybe sleep is the main thing. Maybe they need a little stretching. We're not crack them and stuff like that because they're mostly made of rubber and jello at that point and muscle. But it's yeah, focusing on the nutrition from the aspects, at that point you just want them to eat and eat real foods. So I think, yeah, it depends on definitely on the age, but we're not going to talk really hormones unless their hair's falling out and maybe they have undiagnosed, whatever. What do you do for tension headache?
Oh, I do a lot of things. It actually depends on where their issues are. Like,
So if I have like headaches that just start here, what would you do?
a lot of times I would do pressure point therapy up along the ridge of the skull. And then I would also go into all those SCMs right in here. And actually, a lot of times when I have tension headaches, it actually has a lot to do with the shoulders too. Yeah, so traps, levator, scapula, underneath the arm to try to pull and drain out all of the rotator cuff insertion area. A lot of times traps will be a big part of it as well, I see. So I'll go into not traps, my bad. Triceps is what I meant to say.
Triceps, yeah.
Yeah, which most people don't know that that's an issue. Like that will pull on all of those shoulder
It's like
muscles.
hamstrings in the low back.
Yes.
Yeah, if you just, I always talk about girdles, so shoulder girdle, hip girdle.
Yep.
Like relate it, like, well, this is an issue. Well, how is that an issue? Well, just like your hamstrings pulling your low back. That's total sense. It makes total sense.
Yeah, so a lot of times people will be like, I don't know, it's my head, it's my neck, and I'm like, I know. I know, but this really is a big part of what you have problems with.
So the kinetic chain.
Yeah, and then so I really try to do a comprehensive of all things. So I'll go into all the sinus pressure points, a lot of the masseter muscle in the cheeks, because a lot of times people also like grit their teeth and grind at nighttime, or even when they're stressed out, they'll have like this big, they'll just bite down really hard when they're in a stressful situation. Also, they do this whole thing where they like wear their shoulders as earrings. And I'm like, oh my goodness, you've got to not wear them up there. That's not where they belong. But so many people, they either do this and they're at a job, where they're typing and pulling forward. So then pecs get really tight. So it's just
balance.
It is. It's so much balance. Like we were saying earlier, like trying to pull them backwards and get all of the back component to actually fire properly and pull them back out of this compressed fashion forward. It really can help tremendously to pull them back. But a lot of times they really struggle with trying to get out of that position because they're constantly on a computer all day long.
Well, it's safe too. It's protective.
It is.
Yeah. Extension's hard.
But everything that you do is that way too. It's like, you have a baby, they're in front of you. You're cutting your, vegetables, you're cooking, and whatever you do, writing a check, whatever you're doing is right in front of you. I know writing a check.
I write checks
totally
all day.
out. Yeah.
That's all I do. I just sign checks.
That's old school.
Oh no, I use checks still.
Yeah, I do too. We're old school.
I don't fill them out, I just sign them.
Yeah. Mm-hmm. So
we didn't even talk about jaw. That's a huge one. I do internal, the lateral pterygoid in the mouth. We release that with ART. That's a huge one. We can needle the masseter. We can needle the temporalis. We can get into the scalp. I mean, I know you do a lot of scalp work.
A lot.
That's huge. And then talking about splints and different mouthpieces that they can use, that's a whole nother realm of headaches. And that could be still tension headache, but it's related to the stress. And so then I'm going to, again, talk about how can you minimize, stress. Because this one thing is like, okay, we can deal with the symptom, but then what is causing the stress? And if there's things that they can manage, at least make them aware that maybe that's what's causing it.
Yeah, truly. And I think a lot of times they don't even know until you start pushing on things, and they're like, oh,
I didn't know that was sore.
I did not know my mouth had an issue, I do a lot of ear pull, which that actually can calm all of the sides of the neck, which is a really crazy thing that I came upon.
Well, that makes sense because your eustachian tube is so close to that C1, and then C1 has so many attachment points, and then that's literally everything, like your SCMs and all your erector group, and it makes sense.
It makes a huge
once you start like exploring it. And,
everybody hates it, but
something I didn't bring up, but like one of the ways that you think about this is we call it the evidence-based practice or evidence-based approach or medicine, but basically it's research. So you look at the research. Sometimes we look at research. We have continuing education. Sometimes the other component is experience. So that's what you're talking about. Like we stumble upon these things and we know, hey, this has worked. And then the third is the patient preference. So those are the three pieces of someone that actually cares about the patient. It's like the evidence-based approach. But if, like you're saying, hey, if I yank it, it doesn't matter what it is, but if you find out that this helps and the patient's on board, even if the research doesn't show it, like that's how we find stuff before the research happens. Maybe we do research on it later, but that's a big part of what we do is just like, it's experience. Yeah. But then also if you take the research and then the patient preference, if they don't like you pulling in the ear, I mean, maybe you're like, you convince them, but that first day you're not going to pull on it. No. You're not going to crack their neck. You're not going to stab with needles.
I want everybody to love me first.
Yeah. So you got to build that trust.
Yes.
And, hey, I'm
truly,
going to I'm going to stick my finger in your mouth.
Yeah.
Let's
cool.
go. Yeah, those people forget about that. Like, if you go to a doctor that's forcing you to do something you don't want to do, and they're not having that conversation, I think that's why I appreciate what you do, is you have that conversation, you build that trust, you're not going to force them into a treatment plan they don't want to do. And I'm hopefully the same way.
Yeah.
Yeah, you just meet them where they're at.
That's right. I think that's a lot of it. Mm-hmm. A lot of it is meeting where they are. And actually where, and then as you feel through things, I mean, you learn more about them through just touch than anything else, I think. Especially when, once you start to have hands-on in a situation with anybody, then you feel the little pieces fill into the picture. It's like a big puzzle that you're trying to solve.